All right. Hello, everyone. Thank you for joining us today. My name is Jennifer McKeithen. I am the Communications and Marketing Director with Trillium. And we have started sharing these information sessions to inform our audience and those that we serve throughout this process to move to the tailored plan launch. I just wanted to go over some instructions for today. So we do have this event on mute, but we will be able to accept questions using the Q&A block at the bottom of your screen. You're welcome to type those in at any time. We will be pausing in between each slide. We know it's sometimes a little bit difficult to maintain your question until the very end, so we will be accepting those as we go through the presentation today. Excuse me. And along with that, any questions that you do submit, we would like to ask that you keep those to a general topic. We don't want to share any protected health information with these questions, so if you can keep them in general in scope, and we will do our best to answer them. If you have any information about specific personal details, you can definitely reach out to our call center or to a Trillium staff person to help answer. And if we do receive a number of questions that we are not able to answer given the time allotted, we will collect those and include them with the other question and answers that we will post on our website after the event. And just a reminder that this event is being recorded so that we can share the full presentation on our website after. So today we will be hearing from Chris Hartnett. He is the manager of our behavioral health crisis line. And then towards the end, we will also hear from our Central Regional Director, Dave Peterson, on the direct ways that we will be interacting with community agencies and partners as a part of the Tailored Plan launch as well, too. So now I will move it over to Chris, who will share the outline and get us started on the presentation.
All right. Thank you, Jennifer. Yep. So as Jennifer mentioned, my name is Chris Hartnett. I'm the Behavioral Health Crisis Line Manager. And what we will be talking about today with regards to Tailored Plan launch is what will be staying the same, what changes are going to be coming, what notifications will be sent out, and what do members and recipients need to do before December 1st, which is the launch date of the Tailored Plan. So first, what is not changing? Trillium will continue to oversee services for serious mental health, substance use, intellectual and developmental disabilities, and traumatic brain injuries in 28 counties in eastern North Carolina. This will include state-funded recipients, Medicaid members served by the Tailored Plan, and exempt members who will remain in Medicaid Direct. We are also continuing to maintain our member and recipient service line. That number is listed there, the 1-877-685-2415. We will also continue to have our provider support service line at 1-855-250-1539. And those hours for the member and recipient service line have recently changed to include Saturdays as well as Monday through Friday from 7 a.m. until 6 p.m. Our online provider directory will still be available on our website, or our member and recipient services can give assistance in finding a provider should someone call in and need that assistance as well. We still have the ability to where anyone can voice a complaint or file a grievance. They can do so by calling our member and recipient service line. There's also a form on our website that they can complete, or they can also do so through providers or their assigned care managers. We will also continue to have tailored care managers who will still help and monitor care plans.
Hi, Chris. We did have two questions come in and they may be covered on other slides. I don't believe so, but I wanted to bring them up now. The first one is, will clinical assessments be completed by the same provider which provides the service, for example, SACOT or SAIOP? And if we do not have staff on this call who can directly answer the questions, as I shared earlier, along with collecting questions that we may run out of time for, if there is any question that arises that we do not have the appropriate staff ready to answer, we can collect them and provide answers in the Q&A on our website as well.
Yeah, I don't see that being any kind of change. Anybody who is going to receive any type of enhanced service, such as SACOT or SAOP or IOP or however you refer to it, will still need an assessment with a clinical recommendation as part of that. And our providers will continue to provide those clinical intake or, biopsychosocial or comprehensive clinical assessment, whatever you refer to it as, in order to create that justification for the need for service.
Thanks, Chris. And this is kind of a related question is, will members receiving SACOT or SAIOP have care managers?
So everybody in the tailored plan through Trillium will have an assigned care manager. Now, who performs that care management function may differ from person to person, but every single member in tailored care management will have an assigned care manager, yes. Well, unless they do opt out. They will have that option to opt out of receiving tailored care management, but that would only be something that they decided to do.
Thank you. Those are our only questions so far.
Okay. So these are some of the changes that we can expect. First off, there will be new terms referring to Medicaid members and state-funded recipients. The members and recipients will also be receiving separate handbooks for each of them to review with appropriate information and requirements. As I had said previously, member and recipient services will be available on Saturdays as well. This started on June 15th of this year, so Monday through Saturday from 7 a.m. to 6 p.m. Trillium we will be launching our new 24-hour behavioral health crisis line and nurse line, and those will go live in November of 2022. New benefits will be listed on our website will include physical health care and pharmacy services, and these will be for Medicaid members only. Our updated provider directory will include physical health care providers as well for our Medicaid members. And new value-added services under Trillium Advantage, including things like gym memberships and transportation vouchers, will also come in and take effect.
Thank you. And I did have two comments come in the Q&A that are additions or clarification about those previous questions. One of them is related to about ICF individuals will not have care managers. And that is correct based on the level of care that would be the case. So thank you for that additional clarification. And then the additional question is about the assessments, that if the same provider will do the assessment, or will another provider have to complete the assessment? The question was not if an assessment will be needed.
Yeah, I mean, the same provider is certainly able to complete that assessment. There really wouldn't be a change from how things are done today. So should someone go to agency A and receive a recommendation for a level of care of SACOT, but that agency did or didn't do that service. If they didn't do it, they would refer them to an agency that does complete that and offer provider choice to the member or recipient. And if that agency does that service themselves, then that member or recipient again would be offered provider choice, and that individual would be able to make their own determination. So Yes, you would be able to. There wouldn't be a change from how things are done currently. Okay. Those were all the
Thank you.
questions.
Those are all the questions for now. I was just checking to make sure there wasn't another one that came in, and I think we are good.
Okay, so other changes to expect, Medicaid members will be able to contact the North Carolina Medicaid Ombudsman Program. An ombudsman is an impartial or fair third party who helps answers questions and resolve issues. Trillium will also share new ways to improve well-being through promotional materials about conditions such as asthma and heart health, or also quitting tobacco. Trillium will have a greater collaboration with ensuring that correct member and recipient contact information uh, is obtained through files and reports. Trillium will coordinate requests for non-emergency medical transportation, which is also referred to as NEMT, for Medicaid members. Medicaid members will be eligible to receive tailored care management. Tailored care management is available through care management agencies, Advanced Medical Home Plus, and Trillium. A care manager works with members and a team of medical professionals and approved family members or other caregivers to consider any unique health-related needs and find the services needed for that individual in the community. And the North Carolina Medicaid enrollment broker will assist in choice counseling on selecting a health plan and switching to standard plans if ever requested.
All right, thanks, Chris. We did have a question come in. What is the difference between care management and case management? And for that one, we may need to get some additional clarification. I think we have a very basic or high level answer, but we do have a link that we can share as part of the Q&As that are posted that perhaps directs you to the North Carolina Department of Health and Human Services website. They can go into the appropriate level of detail for that question.
Okay. And so when it comes to mailings and notifications, Trillium will start sharing information on tailored plan and Medicaid transformation section of our website starting this summer, which has actually already happened. If you go to our website, which is www.trilliumhealthresources.org, at the top there is a banner where there's a link for you to click to get more information on tailored plan. And there will be different sections for members and recipients, for stakeholders, and obviously that's also where many of you may have signed up for this information session as well. The enrollment broker website is targeted to tailored plans, or targeted to tailored plans is available now this month. In August, the enrollment broker will start mailing open enrollment packets to all eligible members. Members may be informed that they're being moved to a standard plan and will have instructions about picking which plan. Once members receive the enrollment packet, they will be able to select a primary care physician. Again, that's for Medicaid members only, and tailored care management provider if applicable. As we mentioned, people do have the ability to opt out if they so choose. Trillium will be sending out welcome packets starting in November. And these will include a letter with important information and the member or recipient handbook. Members will also get a Medicaid ID card in a separate envelope. Starting in November, Trillium's other phone lines will also be available, as I previously mentioned about our nurse line and our behavioral health crisis line. And then after the launch on December 1st, you will see new content available across our website. So what to do before
My apologies, Chris. I did get one question in the chat that I responded to, but wanted to make sure to share out loud as well, in case others have the question. The question was, would members be encouraged to call the behavioral health crisis line instead of mobile crisis now? I had responded that that was simply another avenue that members could utilize, in addition to calling the mobile crisis services directly. But if there was anything that you felt should be expanded upon that, I wanted to share.
Yeah, that's largely correct. It is just it's another avenue for someone to receive assistance. That number will be published on the Medicaid cards and available to individuals to call should they be in a crisis, and it is available 24/7. We have the ability to link them with mobile crisis should they need. But really, just like with many things here at Trillium, it's a no wrong door policy that someone can call any number that we have to try and receive assistance, and we'll get them to the correct place.
Thank you. And another follow-up question related to the letters. I'm thinking these letters are referring to either the welcome packets or the letters from the enrollment brokers. The question was asking if these will go to members or provider agencies, and they will be sent to whoever, whatever name is designated, whether that's the individual, a legally responsible person, or a guardian that is indicated on the list that we will be the enrollment list we will be pulling from. So in most cases, they should be going to the home of the member and recipients, excuse me.
Any others to make sure that we address before?
I do not see any other questions.
All right. Yep. So what to do before December 1st? If the enrollment broker sends a letter that moves a member to the standard plan and they have reasons to request remaining on the Trillium tailored plan, there will be instructions in that letter that they should follow on what to do and how to go about trying to remain in that tailored plan. When members get the letter about choosing a primary care physician, again, there will be detailed instructions in the letter for how to make that selection by the deadline of October 15th. If members do not choose a primary care physician, one will be assigned to them. They do then have the ability to request a change by calling into the member and recipient services line. There are some parameters about how often that can be done, and all of that is also detailed in there. Members can sign up to get notifications, such as our email newsletters and text messages, by visiting our website, www.trilliumhealthresources.org, and a community newsletter is available as well. People can visit our website and social media pages to see about the schedule of upcoming information sessions, such as this one today. And then also, as I had mentioned before, if members do not choose a tailored care management provider during the choice period, they'll be notified of their care management assignment through the mail in a tailored care management enrollment packet. If they do not wish to participate in tailored care management, the enrollment packet will also again explain how they can opt out of that tailored care management.
We did get a question come in related to providers, and it's regarding Provider Direct, if that will continue to be used for IDD TARs, treatment authorization requests, and billing, and when will IDD providers receive training? Yes, that process, we will be modifying some of the pages on our website to reflect the information that will be needed as a tailor plan. So some minor word differences will be happening, but our network department is working through a actual training plan that they will be coordinating and providing to our network. So that communication and dates that will be ready will be coming directly from them. So I will let them promote that when it is ready on our My Learning Campus platform for providers to use. But I will say that we do have links for any provider to sign up to receive our network communications bulletin from the homepage of our website. So if you are not currently receiving those to be notified of important information, like when those trainings become available, I would advise you to go to our homepage to be sure to register to receive those. I believe that is the only additional question that has come in. Chris, thank you so much for the great information you have been sharing. And now we will be hearing from Dave Peterson on some additional changes and approaches that will be happening with how we work with our community stakeholders.
Good afternoon, everybody. I'm glad you could make it. I wanted to just briefly hit on two kind of work streams that I've been working on. So as part of the tailored plan, one of the areas that we have not worked on in the past is how to work with the various tribes in North Carolina. It is required for us to begin that relationship, and we're very excited about doing that. And we've had a couple of meetings with the Eastern Band of Cherokee Indians, and they have helped us put together a tribal engagement strategy. And this was part of our application up to the state to become a tailored plan. With that being said, first and foremost, we're in a listening and learning mode from the different tribes because they have a lot of knowledge of how services and supports need to be rendered, and we want to learn from them. And so, that being said, we're in that stage of the process of trying to work through how to get the appropriate level of services out to the different tribes. And so we're really excited about getting that started. And then the other piece that we have been working on for many, many years is working with all the various stakeholders in our community. And when I use the word stakeholders, sometimes people consider stakeholders providers, but what we consider stakeholders are more of the law enforcement, the social services, health departments, hospitals, schools, faith communities, voc rehab, advocacy groups, and so on. So we've been doing that for many years in our community collaboratives, but we want to make sure that as we're going through this tailored plan process, how is this going to be impacting the different stakeholders? And if you just think about how it's impacting social services, this is a significant impact on social services. It also has a significant impact on health departments. And so with that, we want to make sure that all the stakeholders that we've been working with for years and continue to need to expand the list that I just mentioned, just in case we're missing some folks. Because I'll say every time we're out into the community, there is another group that we may need to reach out to get their input on. And so we're really working diligently on trying to make sure that we're hearing the voice of that community. And with that being said, we have 28 counties, and in several of those counties, there's a lot of different communities too. So we need to make sure that we're in those communities, listening to the needs of that community and building those relationships to better serve folks in our system. So that's all I have to say on that, and I will pass it back to Jennifer.
Thank you, Dave.
Yep.
We did get an additional question come in regarding the letters from the enrollment brokers. So we were sharing information about what is going out from the enrollment broker, and also in addition to that, the welcome packets. So Trillium will be sending out welcome packets to those who will be served by us. And that does include state-funded recipients will get a welcome letter, and also the state-funded recipient handbook will be included in that welcome packet for Trillium. As far as what the enrollment broker will be sending out, that will be information going out to Medicaid members. So a state-funded recipient can definitely call Trillium if they do not receive a welcome packet from us later this year after they go out. But as far as the enrollment broker, that would not apply to them. And I just wanted to share as well, we'll definitely give some time as others are considering additional questions. And we do have links and information about the enrollment broker and also the ombudsman program are available on our website for you to visit their web pages for more information, but they are hosting similar information sessions too. So they are additional wonderful resources to participate in some of the presentations that they will be sharing as well to get more specific information directly to them. And we are collaborating with the enrollment broker as well. They'll have some community information sessions coming up that Trillium will be participating into later this summer. Okay, we did have a question come in regarding provider contracts. So again, we definitely want to make sure that any provider that is maybe waiting on an updated contract, that our network team has been very busy with communicating directly to our provider network and getting the updated contracts and required information out to them. So I would suggest if there are specific questions about your individual contract, you can definitely reach out to our provider support service line as well to ask specific questions related to that. And we have another question about the behavioral health crisis line. Hello, David. Will this only be taking calls from Trillium members and recipients?
So yeah, that's a great question. So anyone can call the number. Our ability to assist people who are not our members or recipients may be a bit limited just with our knowledge of what other insurances may accept or not accept. However, we answer every single call that comes in and do everything we can to help them to the best of our ability. So I hope that answers that question.
Thank you, Chris. And Dave did share some additional details on the upcoming sessions with the enrollment broker that Trillium will be participating in. That will be on July 18th and also August the 18th. And also some of the standard plans will be involved as well, and we'll be giving updates on the steps and processes that have been completed and are upcoming for implementing the Taylor plan. And Dave just corrected me that that July date was actually July 21st. So thank you for that clarification. And definitely, please feel free to continue entering any questions that you may have into the Q&A. But I did just want to remind everyone that we will be posting the recording of this presentation on our website. If you have not visited lately, from our homepage, trilliumhealthresources.org, the large image at the top of the screen will be dedicated to sharing about the tailored plans for the next several months. So you will just need to click on that image to take you to the pages that we have that are dedicated to sharing this information. I apologize. I have a daughter at home. If you're in a similar situation, I'm sure you can relate. But we will share the recording and also the questions and answers, including the few that we wanted to clarify with additional information will be posted after this event as well. We will also be posting the dates and registration links on those same pages on our website for these upcoming information sessions. So we hope you will continue to participate and join us for those in the coming months. If you do have any questions that maybe come up after this call, you can definitely send them to our Trillium email address, info@trilliumnc.org, and we will respond, but also collect those for providing them on our website as well. We did have an additional question come in related to care managers, if the job description will change with the tailored plans. I assume that means in addition to the job description, but the actual responsibility and their day-to-day roles too. And I think for this question that we would like to get some appropriate supporting information because there's a lot of details that can be included. But I definitely think that we will follow up on that and include it in the Q&As that we are posting to our website after. And if there's anything specific regarding that, if you wanted to add that to the Q&A to make sure that we capture all the details that you're looking for in that answer too. An additional related question came in regarding the care coordinators assigned to recipients. Will the job responsibilities remain the same? We will get some clarification regarding that and include that in the same response to the other question too. All right, everyone. I have not seen any additional questions come in the last few minutes. So we can wrap it up. But if anyone does have any questions that maybe pop up after we close out this session, you can send them to info@trilliumnc.org. And as noted before, we will get the recording and also the questions and responses up on the website in the next few days. And we look forward to having you participate in the upcoming information sessions. Thank you again, everyone. Have a great day.